name is Ariane Kalingo, or Air for short. I'm Miss World Philippines 2016 First Princess, and a few years ago, as well as just recently, I got the non-surgical nose lift with Contessa. She did such an amazing job. The process was really smooth, and I'm feeling really great and rejuvenated because of it. And today my concern is my jawline. I have a big jawline, so what I would like for her to do is really lift it up just so it appears a bit smaller. I'm really excited to see how it will look. Don't forget to click the subscribe button and notification bell to keep you updated.
Good day everyone, welcome to the CSA Medical Aesthetics. Dr. Contessa here, your certified aesthetic physician. In today's episode, we'll have a welcome or a coming back from one of our former guests. Let's all welcome Miss Ariane.
Hi everyone, I'm Ariane Kalingo. I'm so happy to be here with Dr. Contessa. She did such an amazing job on my face before with the non-surgical nose lift, and I'm looking forward to seeing what she'll do with my jawline.
Yes. Okay, so thank you for being here, Miss Ariane. So for today, we'll do an assessment for Ariane. Okay, every time for example, you come to us, we need to check the face area and analyze what are the parts of the face that we need to treat on. Okay, so for Ariane right now, what I do is, usually I do the so-called divisions of 3, or like the proportions of 3 on the face. The first part is the upper third, and then the second part, the middle third, and then the lower part is the lower third of the face. Okay, so on the upper third of the face, Ariane is still very young, okay? Still 20?
29.
Oh, okay. So for Ariane, okay, on the forehead part, check on any presence of lines or wrinkles. But for her, there are no evident dynamic line, rather a static line or wrinkle, right? I don't see any line. Okay, but sometimes when we ask them to raise their eyebrows, can you raise your eyebrows? There you go. We can see the so-called dynamic wrinkle. But dynamic wrinkle is like when you rest your face, then it's gonna go back again. So no problem with that. But for some people, we start to treat with some toxin already to relax it and to prevent deep lines or deep wrinkles. And then we ask them to frown, do the frowning. There you go. So actually, there's really no evident static furrow or wrinkle on the glabella area. So actually, just a little bit of a Botox there, but for her right now, it's not really a necessity. It's not a necessity yet. Then we tell them to smile, to check on the sides of the eyes. I don't see any crow's feet at the moment. Okay, still young. Then the next part is looking at the under eye region. So for some individuals, we check the under eye, and we have the so-called beginning hollow under eye or thinning of the skin under the eye. For Miss Ariane, we see some signs already. Okay, so this one is attributed by, for example, with your work, or like you're overstressed, over fatigue, or the lack of sleep. Okay, and other factors that could contribute to it. Okay, for now, well, it's still fine, it's still okay. So the lower part is still okay. Now, checking on the middle third of the face, okay, what we do check there is the so-called Indian groove or the mid-cheek line here. So far, looking at the profile view, there's still a good convexity of the cheek region. So still very nice OG curve. There you go. And then the other one that we check is the nasolabial line. So it's not deep, still okay. You agree, Ariane, with all that I said?
It's a lot. I think you're very smart and very knowledgeable of what you're doing. So
yeah, thank you. And the nose area, the center of the face, it's for me, it's perfect. Good slope, good angle here, the nasofrontal angle, and a good nasolabial angle. Thank you. And a good like intercanthal width there. It's very nice. It's within the center of proportion of the face. Now looking at the lower third, actually Ariane is really pretty beautiful for me. Well-proportioned face. everything is okay already. And that's the definition of beauty. Everything is symmetrical, harmonious, in proportion, right?
Yes.
Yeah. So looking at the lower third of the face, okay, because right now we have this shape of the face or contour of the face in this generation. A lot of women are wanting the so-called V shape, V contour, okay? So for female face, we have this like ideal shape is like an oblong, okay? But for Asia, most of the time women have this rounded shape of the face. And right now, women come to our clinic to narrow the face, particularly the lower third of the face. So for Ariane, it's not really like an anti-aging that we're doing. She's still young, okay? It's more of highlighting the beautiful parts of the face, enhancing, right?
Yeah.
So for more of a beautification, enhancement, and also prevention. There you go, prevention of the signs of aging. So for Ariane right now, I wanted to work on the lower third of the face to still give an emphasis on the right shape of the face. Because for Ariane, actually, there's a narrowing on this, but we wanted to somehow still narrow it, right? Because her concern, actually, if I'm gonna ask you to what your concerns are,
right,
probably you'll be sharing or telling me, Doctora, this part of my face, can I still do something? Exactly, there you go. So, we'll work on this angle of the jaw, then we'll work on this mandibular part here, okay, and we can still probably do something on the center, the chin part. So, it's more of the lower third beautification, what kind of treatment, what procedures, and we'll watch on that when CSA Medical Aesthetics return. And we're back. So we're doing a treatment for Ariane. So we did an analysis and assessment a while ago. So we'll be working on the lower third of the face. So we checked on her photo and we've noticed that one side is slimmer or narrower than the other side. So we were doing the so-called analysis of this lower third of the face. The first thing that we check is on the masseter muscle, and we have our client like clench the teeth. So clench the teeth, Ariane. So actually I felt for the strength of the masseter muscle, and both sides have like a similar strength or similar like hypertrophy. We call that masseter hypertrophy. But when you look on the forward part, this part here, the mandibular line here, we notice that the right side has more of a good contour or a good shape here, or it's like narrower as compared to the left. Okay, so the left part of the lower third of the face has more of a tissue volume, and the right side has like the right tissue volume already. So we wanted also to balance it to make it symmetrical, okay? Because we know that beauty should be balanced, should be symmetrical. Do you agree with me, Ariane?
Absolutely, it should be symmetrical.
Yes, thank you. So the first part that we want to work with will be the tissue layers of the face, and we wanted to balance it. We wanted the tissue volume to be symmetrical. We'll start working with or using our device, the so-called Ultherapy. So the good thing is we have this kind of machine that can target inner tissue layers. Like if you wanted to reduce some of the subcutaneous fat layer or reach our fibromuscular layer, we can like reach it to make it more contracted or make it more reduced, so we can balance our tissues left and right. Okay, so a while ago we applied topical numbing cream. Okay, of course you have to cleanse everything first and then numb the skin. So for an hour we numb the skin, then we can start using our Ulthera device already. Now the approach that I will use for Ariane will be the so-called customized Ulthera treatment, because we have to make sure that we did an assessment and we have to make sure that we'll give the right number of Ulthera shots per side of the face. So since we have found out that the left has more of a tissue volume, we wanted to add more shots on the left side of the face. So this is an easy procedure, so we can just do it as we go on. We'll be discussing a little bit of what we're doing. Okay, so we're using the 3.0 and we have an energy of 0.3 joules here. So we'll check on the tolerance of Miss Ariane. Okay. So I wanted to start working on the left side here. Okay. So let me know, Ariane, what you're feeling, or if there is any discomfort, just let me know. Just give me a signal. Okay. I'll have this tip on the skin and just press on the button there. How was that?
I didn't feel anything.
Okay, so she felt nothing. We wanted to increase the energy to 45. Okay, so we'll just continue with this. I'll give you like 40 shots here. How's that?
I can feel something.
Okay, so but is it tolerable?
Mm-hmm.
Okay, so maybe we'll just use one. Okay, there you go. So we'll just continue working on the left side. The 1.5 transducer here. So a while ago we used a 3.0 to reach the subcutaneous fat layer to reduce that layer, especially on the left side. Now I'm shifting to the 1.5 to reach your dermis so that we can stimulate your fibroblast cells to synthesize new collagen, elastin, and other tissue matrix there for the skin tightening and firming. And we wanted to prevent the development of nasolabial folds as well as the development of marionette lines. So it's an anti-aging and a prevention for that aging process. So let's start with the left side here. So I have a 0.25 energy. Okay, let's work on this side. Well, actually, the higher layers have more sensory receptors. Continue to the right side of the face. We're still on the lower third of the face, so the lower third beautification. We have done the Ultherapy, and right now let's proceed with the so-called Masseter injection using our incobotulinum toxin. So for Ariane, we wanted to work on both the Masseter area here, and we'll be using the so-called Zeumine 30 units per side. Since upon the assessment, we've noticed that there's an equal strength and mass of both the Masseters. Okay, so what I do before injection is I make a marking. Like for example, if you wanted to delineate the upper, lower, the anterior, and the posterior borders of your masseter, you can start with making a horizontal line from your tragus of the ear to the alar groove. So like a horizontal line like this. Sorry, Ariane. Okay. So that's your upper line. And then your lower line will be just the mandibular line here or the jawline here. And then for your posterior, will just be at the back area here, posterior line straight, vertical. And then palpate for the anterior border of your masseter here. Okay, so this is already the anterior border of the masseter, so we'll make also a so-called vertical line there. So you have to really make a marking of your anterior masseter so as to avoid touching the muscles anterior to that. For example, the rhizorius is inserted on the anterior aspect of your masseter, so it attaches to the corner of your mouth. The reason is if you diffuse some of your Botox or your incobotulinum toxin into this muscle, it's gonna affect the movement of the muscle. So whenever she smiles, there might be an inhibition of that muscle there, and there will be an asymmetrical smile. That's why we have to stay 1 cm beyond that anterior aspect of your masseter. So this is now the part where we can do injection. Since I'll be giving 30 units, I'll just use the 3-point injection technique. So I'll make a 1 at the superior part and 2nd at this part and a 3rd one here. So I'll be covering the entire masseter muscle. Okay? Any question, Arian, on that one?
Will I be able to apply makeup after since you're doing injection?
Okay, so since we are using only a tiny gauged needle, because immediately after we'll do the eyes, so the tiny opening will also close immediately.
Oh, okay. Great.
So after this, of course, we'll still do the eyes compress, everything. Then in a little while, you can do your makeup already. Okay, so since I've been an injector for a very long time already, so I know where to inject. I can clean the area, so asepsis and antisepsis. So for me, I'll palpate for the strongest part. Can you clench again, please? So like this is the strongest part there, and I'll inject. So my first injection will be a 10-unit amount of my incobotulinum toxin. So you can reach also the deepermost portion of your masseter, because the masseter has different like compartments also. Make sure that you reach the deepest layer of your masseter muscle, and then also you can gradually pull out your needle and push your material or your product. So the entire masseter will be injected with your incobotulinum toxin to give a balanced relaxation of the muscle. Otherwise, you might cause a so-called paradoxical bulging. Okay, so that's an added information. And then I'm working on the inferior part. Sorry, Arian. So, but it's tolerable, right? It's okay. It's just fine. Because we're using a gauge 30 needle there, some tiny injections. That's my second 10 units, and then my last third 10 units here. The last 10 units. Okay, so I'm done with the right side. So let's move to the left side. Okay, so I'll use 30 units on the left side, so just the same amount. For some cases, when you have done your assessment and you notice that one side is bigger than the other side, you can give an extra unit on the side that is bigger, okay? So I won't do any more marking there, so clean the area again, okay? Disinfect. And you can just palpate for your masseter here, okay? So I felt this part. So this is the anterior border, and I'll avoid that area already. So I'm just gonna stay lateral to my middle finger here, and I'll just inject the first 10 unit there. Sorry, Arian, I know it's gonna be, or some are saying there's a sting there. So the first 10 unit will be here. Then I can go inferior to that, my second 10 units. There you go. And then my last 10 units. Okay. So for this kind of botulinum toxin type A, we tell our clients that we can expect result. Actually, it has a fast onset of action. Some people are saying it's on day 3 that they notice result already. But we give like a 1 to 2 week period to really expect improvements on the treatment that we've done. Okay, so again, this one has no downtime. You can go back to your usual activities, and so we'll do ice compress later on, then immediately that tiny opening will close also, so you can put your makeup on again. So we did the Ultherapy, we did also the masseter injection. Now, I need to assess the chin also as part of our V-contour treatment. The way to check that is the so-called rickets line. For example, I use my pencil here, my Bellotero pencil here. So just on top of the tip of the nose and then your lower lip. And then if it's within that line, then we're good. That's a good rickets line. Perfect. That's great. So we'll show the result to Ariane when CSA Medical Aesthetics return. And we're back, so we'll show the result to Ariane. Ariane, here's our mirror.
Oh my gosh, I see a difference already.
Yeah.
Instant.
Noticeable, right?
It's tighter, it's more slim.
And
Love
balanced.
it. Yes, balanced, symmetrical.
Right, because we were talking a while ago about the left and right side. The left has more volume than the right side. So we wanted to like give an equal size of both the right and the left. And so as a review, we did like more shots of your Ulthera on that side and then less on the right. Okay? And after that, we did the injection of our masseter so that we can slim this side of our face. So for women is, we wanted like a narrower bigonial width, okay? And then actually the bizygoma width and the bitemporal width should be equal. Then when you go to the lower part of the face, you have to have a narrower bigonial width here, bigonial width, okay? Or the angle of the jaw here. There you go. So I also mentioned about the center chin area here. So we have like a balanced rickets line for Ariane, so we don't need to inject any more filler there. And the thing here is that it has a very good shape, and I really like the tapering here on this side. Okay, so since we've done the Ulthera, Ariane, we still expect more results.
Right.
Because this one still will give you like that improved and lifted lower third of the face up to 12 weeks.
Okay.
So with the toxin that we've injected, the Xeomin, we still wait for a maximum effect of 2 weeks. Do you have any questions?
I think you've answered all my questions. The process was really smooth. She did such an excellent job as always, and I see the difference already.
Yeah, thank you so much. And later on, we'll advise you what not to do, what to do, so you can still continue with an ice compress and no medications needed on that. Okay, so any message, Ariane, to our televiewers?
I highly, highly recommend Dr. Contessa. She's so knowledgeable about everything, and she really explains everything detail by detail. I'm really pleased with the result, and I look forward to seeing what will happen in 2 weeks.
Yay! Thank you, Ariane. So
you.
we'll have a follow-up with you. So if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the CSA Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 and 0917-504-4268. So our other YouTube videos, and if you wanna see Ariane's old video, like 5 years ago, 6 years ago, okay, you can check at our YouTube channel, Contessa Salvador. So thank you. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.